we were very honoured when Dame Quentin Bryce agreed to come along and open the roundtable discussion and participate in some of the activities that we're doing today. So thank you very much for coming along, and I'd like to invite you to open the roundtable. Thank you.
Thank you. Good morning, my friends. I want you to know how thrilled and delighted I am to be joining this very important roundtable. This is a gathering that has a huge responsibility, I believe, and I'm so pleased to have the opportunity to be part of it. I pay my respect to the traditional owners of this land where we gather, the people of the Kulin Nation. And I always like to acknowledge my Indigenous friends who have taught me across my life for more than 40 years now what it means to be an elder. They have been important and influential in my journey in so many ways. I owe to them a great debt of gratitude. One of my loveliest memories of my last days serving as Governor-General was here in Melbourne last year in summer's November at Charcoal Lane, gathered out the back under tall shady trees with Indigenous women, aunties, mothers, cousins, grandmothers, sharing stories, yarning, warmth, laughter. I'm always inspired by the vitality of women's gatherings, the bonds that we share that are deep and strong because our first priorities are always about the future, about our daughters and our granddaughters, our sons and grandsons, the future of our families and of our nation. I want to congratulate the National Breast Cancer Foundation on this vitally important initiative, and thank you again, Carol, for including me. I'm here to listen and learn, and I have to say I'm thinking very deeply as I sit here about my friends in very remote communities in the Kimberleys, in the Pilbara, in Arnhem Land, and of course very especially in far north Queensland, in Lockhart River, where I'm very familiar with the challenges for health services, delivery of health services brought about by so many factors, of course, not the least being distant. And as I think of that, I'm thinking too of the remarkable women, those directors of nursing in health services in remote communities who are there on the front line and who always run a place that's so professional, that reaches out to the community. It's a very proud tradition in nursing, their engagement. And the other thing too is the very exciting work that is being done by, you referred to, young doctors who are pouring out of some of our universities now, I think it's true to say, and particularly James Cook in Townsville, the allied health professionals there. So there's really much to celebrate in Indigenous health, and some of these things we don't talk about enough, I think. I haven't had breast cancer, but when I was asked many years ago now to head up the what was then the new National Breast Cancer Centre Advisory Council, of course I said yes, because we all care very deeply about this very serious disease and want to make any contribution that we can to improve diagnosis, treatment, support, every aspect of life for a woman with breast cancer. We're all connected with it. And again, I think we have an enormous amount to celebrate when we reflect on improvements and achievements in breast cancer care. I think it's been probably the most successful public health lobby in our country, and we see the results of that. But there are constant continuing challenges, and a very absolutely top priority that confronts us now, I believe, is what we are going to be talking about at this roundtable. So I'm very pleased to be here, and I know that in this room are people with high-level professional skills and experience who have much to bring to our discussions. So I'm delighted to be declaring this roundtable open, and to say again how privileged I feel to be a part of it. Thank you, my friends.